The purpose of digital imaging is to generate images to help diagnose and assess disease. So, this is basically the same as your traditional film. It can be used to detect lesions, disease, conditions of the teeth, and surrounding structures that can't be seen clinically. So, again, sounds pretty similar to our traditional film. It is used to confirm suspected disease, will provide info during treatment, can evaluate growth and development, and will show changes to caries, perio disease, or trauma. And it can also help to develop a treatment plan. Let's compare a little bit here the digital imaging versus your film based. With digital imaging, the image is captured on the sensor. It breaks it into tiny little electronic pieces, and those electronic pieces are transferred to the computer. It arrives in what we call analog form, and then it's converted to digital, and it's displayed in seconds or up to just a few minutes. So it's pretty quick. And then the images are stored in the software. And those images can then be manipulated. So you can make them lighter, you can make them darker, you can flip them all around, you can add color to them. There's little coloring tools a lot of times. You can use the ruler to show measurement. So there's lots of different things that you can do once it's stored in the software. With our film based, with our film-based images, an X-ray strikes an intraoral film. So it goes through all of the stuff inside of the tube head. An X-ray strikes the intraoral film. The energy is then stored inside the silver halide crystals. It goes through the chemical processing, whether it's an automatic processor or you're manually processing, it still goes through a chemical processing. And this can take several minutes. It can be quite lengthy, and sometimes you don't have the time to wait, or you would like to not have the time to wait, but given the situation, you have to wait for those films. And this is known as an analog image when it comes out. An image refers to the picture produced. So once you've taken the X-ray and it's converted to all the little electronic pieces and appears on the screen, it's now an image. And these are not limited to just intraoral films. You can use a PAN, a Ceph, or a cone beam computer technology. These are not limited to intraoral radiographs. You can use a PAN, a Ceph, or cone beam. These are not limited to intraoral films. A panoramic, a Ceph, or cone beam computer tomography can all be used and done digitally. Radiation exposure is significantly less when it comes to digital imaging when we're comparing it to the film-based radiation. This is because the sensor is more sensitive than film, so it takes less exposure time. And depending on the speed of the film, exposure time can be reduced by up to 90%. So what they're saying here, the speed of the film, are you using with traditional film A speed, B speed, C, D, E, or F? Comparing to what you're using there, it can be reduced by up to 90% when using digital imaging. A typical digital imaging exposure is 0.05 seconds. 0.05, that's not even one whole second to create a radiographic image. So this also means that it reduces the absorbed dose for the patient. The equipment we need for digital imaging is a little bit different than our traditional films. We still need our X-ray unit, and this can be the conventional intraoral unit, so nothing really needs to be changed when we're converting to digital, except the timer. Inside of the machine, the timer may need to be adapted, but other than that, you can use that same X-ray unit. And the reason we need to adapt that is because your traditional film, it's 1/60th of a second, and digital is 1/100th of a second. So there's a slight difference there, which is why that machine might need to be changed a little bit. The next piece of equipment you need is the sensor. And these sensors are going to vary in size, thickness, and stiffness. It just depends which type of sensor your office chooses to use. They're going to be available just like traditional films, where they come in sizes 0, 1, 2, and 4. And then you can also get film for a panoramic and a Ceph. They can be wired or wireless, so meaning they have a cord or they don't. And the wired is going to be linked directly to the computer with a fiber optic cable. And that cable is going to be 3 to 9 feet long. Sometimes you may need an extender depending on where your unit is located in relationship to the chair. And wireless, and the wireless is going to work via Wi-Fi. Typically, it is a little bit thicker sensor, and it's going to be a little bit more expensive. And there's a couple different type of sensors that are available for use. And the first one is called a charged couple device. It contains a silicone chip with an electronic circuit inside the outer plastic shell, and it's going to be sensitive to X radiation or light. The electrons from the silicone are arranged in what we call pixels, and when photons come in contact with the CCD, it causes the electrons to be released from the silicone and produce an electronic charge. Each pixel has an electronic charge that corresponds with a specific part of the computer screen. This is what produces the latent image. That image is then transmitted to the computer and becomes visible on the screen, or it's stored. And then it can also be printed out on paper as well. The next type of sensor is called a complementary metal oxide semiconductor. It's similar to a CCD, but it does have smaller pixels, so it has a lower power requirement. The type of chip that's inside the CMOS, or the complementary metal oxide semiconductor, it costs less to produce than the CCD, and it can be connected to the computer directly via a USB. The computer is the last piece of equipment here, and the computer is responsible for converting all of those electronic signals that are coming into it into shades of gray. And then all of those different shades of gray are viewed on the computer monitor. Remember, each pixel is related. Remember that each pixel represents a certain number and a level of gray. So when it comes up on that computer screen, each pixel has a specific place that it's kind of already pre-designated to go. So those numbers range from 0 to 255, 0 being black, 255 being white, and this gives us 256 shades of gray for digital radiography. This is part of the gray scale resolution. And To compare it, the human eye can only see 32 shades of gray. So our computer can make up to 256, but we can only see 32. Also, with the computer, the image is going to appear on that screen in about zero point 0.5 seconds to 120 seconds. So in a half a second up to 2 minutes, it'll take for that image to convert itself and appear on the computer screen. This is useful during procedures such as implants and endodontic procedures because with these two procedures, you have to track your progress along the way and you have to make sure that you are putting the instruments in the right place. Taking an x-ray throughout the procedure. Okay, that virus thing popped up. It's not a virus, it's just saying my software is out of date. So I'm just going to go back here and start the slide over. After you've pressed the exposure button and the electrons release and it does everything that it needs to do within that sensor and it travels over to the computer, the image is going to appear in about 0.5 seconds to 120 seconds. So in about a half a second to 2 minutes, you'll have that image on the screen. And that's very useful during implant and endo procedures because you have to track your progress along the way with those particular procedures. And having that tool right there to give you your result in 0.5 seconds up to 2 minutes is very useful and it's going to reduce the chair time for the patient in the long run. Then the image is going to be stored permanently or deleted. Sometimes you will need to print them out if you might be sending them off for a referral or if they're maybe transferring to another office, or you can transmit those directly. So you can send them off through email to whatever office they may need to go to. On the computer, there's several different features that you can use. Some will offer a split screen, so you'd be able to see some will offer a split screen, so you would be able to compare multiple images at one time. So we may be tracking the progress of a tooth to see if it does have an infection or maybe it has a fracture, and you need to see an image from today, and then in 6 months they come back, and then in another 6 months they come back. And you can see the progress of that tooth when you're comparing all three images or how many ever you have side by side. Also, it offers a magnification tool, so you can kind of blow up certain aspects of the picture that you may be looking at. Maybe the doctor is unsure if there is disease or if there is decay, and if they're able to blow up and concentrate on that small area, they're more likely to detect. And the nice thing is you can blow it up to about 4 times its original size. They offer different measurement tools. So if you need to measure the length of the root, this is useful for endo and implants again. And there are 2 types of digital imaging that are available. The first is going to be direct digital imaging. This type of imaging uses an intraoral sensor and transmits the image directly to the computer. What you need here is the X-ray unit, the sensor, and the computer with imaging software. That's it. The sensor will have a fiber optic cable or it's one of those wireless ones. And the image is directly transferred to the computer. And this transfer goes back to that previous slide where it transfers in seconds. And the second type is called indirect digital imaging, and it involves a few more steps. So we are going to obtain the image from a sensor by way of a scanner. So we need an X-ray unit, a PSP plate, a scanner, and a computer. A common type is called storage phosphor imaging, so the phosphor plate, and it uses a photostimulable phosphor image, so PSP for short, photostimulable phosphor image. The phosphor plate is reusable and coated with phosphors. It's flexible and it's shaped like film. So if you were to pick this up not knowing that it was something that existed, you might think that it is just a regular film. You might think, oh, this office uses traditional film, when in fact it's actually digital because it's a PSP plate. And it's going to work with XCP like traditional film, but the phosphors on the plate, the phosphor plate, the phosphors on the plate convert X-ray into light and stored on the plate until erased after scanned. So X-rays come in contact with the phosphors on the plate, it's transferred into light, then the image is stored on that plate until it's erased after you've completed the next step, which is scanning it. So once that plate is erased, it can be disinfected and reused. Unlike traditional film, where once it's used, it's done, it has to go in the trash. And to help with infection control, they do make little plastic barrier envelopes that you can slide the PSP plate into. But you have to be very careful with these because they can be scratched and they are very easily damaged. But each plate can be used up to 50 times. So to process, this is where the scanning comes in. You take the plate and you're going to place it in the scanner. And usually the scanner has some kind of designated slot, depending on what system you're using, a designated slot for the size of the film that you might be using. Then a laser is going to scan the plate to produce the image and transfer to the computer screen. And this can take 30 seconds or up to several minutes to complete the scan. So it's a little bit slower than direct digital imaging because not only do you have to add in this extra step of scanning, but you also have to usually walk away from the room to another part of the office where the scanner is located. So to help with infection control, make sure you use the barrier for the sensor. The sensor cannot stand heat sterilization. So you must be able to protect that sensor. And since we can't place it in heat sterilization, and sometimes chemicals will harm it, we have to use the barrier. With digital imaging, a lot of times the paralleling technique is preferred because there's a little bit more accuracy with it. And beam alignment devices are available that can be used with wired and wireless sensors. Some of the advantages of the digital radiography. It has a better grayscale. Remember, gray resolution up to 256 different shades of gray. And changing the shades of gray, so remember those tools we talked about, the different programs offer different tools. You can change the contrast of the film, you can change the amount of gray. So changing the shades of gray will allow the doctor to better diagnose. There's less exposure to radiation. The speed of viewing, so it's usually quicker. And as we progress, the speed just gets faster and faster. And overall, we have a lower equipment and lower film costs. And this is long term. Initially, to start up, it might be a great sum of money, But over time, when you're not buying chemicals and you're not using multiple films to expose all of the time, or films getting accidentally exposed to light, or films becoming past their expiration date, so you'll save money in those aspects, which makes it lower costs all over, which makes it lower costs overall, and increased efficiency. It's faster, so we're able to do more things in the same amount of time that we could do when taking traditional films. You can enhance the images, so you can magnify, you can sharpen, and it's an effective patient education tool. Because you can magnify, you're able to show things to patients that they wouldn't be able to see on a traditional film. So you can educate them a little bit more and help them understand what their diagnosis is. And it's a slightly more eco-friendly alternative. Again, there's not as much waste because you're not using those traditional films that has the envelope and then the lead foil and then the black paper sleeve. And the chemicals. The chemicals can be very non-eco-friendly if they're not disposed of properly. And the disadvantages. The initial setup cost. Like I said, to set it up to start with, you're looking at a pretty hefty sum of money, but as you go through, you will see that your spending will significantly decrease. The image quality. There are some studies that show that you cannot capture early caries with digital radiation or digital imaging. Image quality is another disadvantage. There have been some studies that show that a digital image cannot capture early caries quite like a traditional film can, but that's up for debate, and that will continue to be up for debate. The sensor size and thickness is a disadvantage. Depending on what sensor you're using, it can be extremely uncomfortable for the patient. Patients will complain that it's bulky and that it may be uncomfortable, and then it can hit their gag reflex as well. And it's a little bit more difficult for infection control. But as I mentioned, if you use that barrier, that plastic barrier, infection control shouldn't be an issue. Wear and tear on the sensor, since you're using it over and over and over again, and some of them have the wire on it, you can see signs of wear on it, and that means it may not work as effectively. And there are legal issues associated with digital imaging. Because you can manipulate the image or you can enhance it, some are saying that it's questionable if it needs to be used as evidence in a lawsuit. So to review, di- di- so to review, digital radiography requires less radiation than conventional because A, the sensor is larger, B, the sensor is more sensitive to X-rays, C, the exposure time is increased, or D, the pixel sense. Let's redo that one. Digital radiography requires less radiation than conventional because A, the sensor is larger, B, the sensor is more sensitive to X-rays, C, the exposure time is increased, or D, the pixels sense transmitted light quickly. Correct answer is B, the sensor is more sensitive to X-rays. Number 2, the method of obtaining a digital image similar to scanning a photograph to a computer screen is called A, direct digital imaging, B, indirect digital imaging, C, storage phosphor imaging, or D, CMOS APS. And it is C, storage phosphor imaging. Number 3, digital radiography systems can be used for which of the following? A, bite wings, B, panoramic, C, cephalometric, D, all of the above. The answer is D, all of the above. And last, all of the following are advantages of digital radiography except A, digital subtraction, B, the ability to enhance the image, C, the size of the sensor, or D, patient education. The correct answer is C, the size of the intraoral sensor.